Scanning the room.
Hi, my name is Mackenzie Kempley, and I'm an AD student here at Williston State. And today I'll be demonstrating taking blood from a central line, changing the dressing on a central line, and also administering medications through the central line. So the first thing I'm going to do is I'm in the bedroom, and I'm going to verify my provider's orders and my MAR. So it looks like he says give all IV medications through the central line and use the port for all blood draws. Central line dressing every 7 days, PRN. Ceftriaxone 1 gram IV push every 8 hours. Ceftriaxone 1 gram IV push every 8 hours. That matches the MAR. And then heparin flush 500 units per 5 milliliters. And that matches. So now I'm going to perform hand hygiene. And also I'm looking at his date of birth. Chester chest, 7/19/19, and that matches. And with all of my IV medications, my central line medications and the flushes, I'm gonna make sure that I'm using a 10 milliliter syringe. Using a 10 milliliter syringe decreases the risk of bursting the line. If you use a smaller than a 10 milliliter, bursting the line is possible. So we wanna make sure that we're doing the 10 milliliters. So I got ceftriaxone 1 gram IV push every 8 hours. Ceftriaxone 1 gram, this vial, and it has 10 milliliters in it. And it's not expired, it's clear, there's no particles, and it's not discolored. And now I have heparin IV flush, 500 units per 5 milliliters. We're going to be giving 5 milliliters, and it's not expired, and it looks good on that end. And since heparin is a high alert medication, I'm going to have my second nurse verify the dosage. And she nodded her head, said that that is good, so I know that that's okay. So now that I have verified everything, I am going to perform hand hygiene and remove my gloves. But just for video purposes, I'm going to leave them on. Okay, so now I'm going to go in my patient's room. Hi, Chester. How are you? Good. My name's Mackenzie, and I'll be your student nurse taking care of you today. I'm just going to be doing some stuff with your central line, okay? So first, can I have you verify your name and your date of birth for me, please? Chester Chest, 7/19/19. Awesome. Thank you, Chester. So I'm going to be first gathering blood from your central line so we can send it down to lab. And then I am also going to administer medications. I have an antibiotic for you, ceftriaxone. It's for your pneumonia. And I have a heparin flush, which is an anticoagulant, which will help decrease the risk of clots in your line so that it stays patent. And then I'm also going to be doing a dressing change, okay? Is there any questions before I get started? No? Okay, good. So the first thing I'm going to do is I'm going to wipe my port. – 10 to 15 seconds. Let that dry and hold it here, making sure that I have it stay clean. Okay. So first I'm going to be flushing the line. Make sure that there's no air bubbles in here. And then after getting the syringe, I'm going to open that. I'm going to pull back and ensure patency by looking at the line for blood. I can see blood and I want to make sure it just doesn't get into the port. And then after that, I am good to start flushing. Okay, so now I'm going to flush using a push-pause method. Perfect, and then I'm going to use this same syringe, and I would have also performed hand hygiene and put on new gloves before this. And then I would have also started or stopped the IV infusion that the patient was getting 10 minutes before I came into the room, before I started gathering the blood. So now I'm going to gather 10 milliliters of blood to discard. make sure I clamp this before I take off the syringe to maintain positive pressure. Okay, so I'm gonna throw this in the sharps container. And now I don't need to wipe this again since I have maintained and I haven't touched it. If I were to touch it, I would wipe it again. And now I'm ready to gather the blood and clamp it. Gather 10 milliliters. You feeling okay? Good. Clamp that. And I would give this to the phlebotomist or the lab tech that is taking that down. And then I'm going to flush it again. Unclamp that. Plus using the push-pause method. Perfect. Great to close that. And then I would hold that. Okay, how you feeling? Good. Okay, so I would take off my gloves, perform hand hygiene, and put on some new pairs of gloves. So I'm just going to inspect the site. There's no redness or swelling, so it looks good. Is that tender? No. Okay, good. It feels okay. Yep. Okay, good. So now that I've done that, I'm going to start your dressing change now. Okay. So, but first I'm going to have you, this sterile pack is unopened, it's untampered with, and it's not expired. Okay, so I'm going to open this so I can grab the mask out for you. I already have a mask on, or if I didn't, I would put one on. And Chester, I'm going to have you turn your head the opposite way of where your port is, okay? And then I'm going to put this mask on you as well, and this decreases the risk of infection. Okay. You just let me know if you feel any discomfort, okay? The alcohol swab helps loosen up because this dressing can be very sticky. I just want to pull, you can pull away to break the seal. Just want to make sure that we're not tugging on the line. Still feeling okay? Good. I know this can be kind of uncomfortable getting the dressing taken off, so we're going to try to make it as comfortable as it is, or as we can for you. I just want to make sure that I am anchoring so I do not pull out the line. And then I'm going to take the bio patch, since it's going to be changed with the dressing, throw that away and take off my gloves. And again, now I'm going to be using this opportunity to just look at the line as well, or at the site. So now I am going to get ready to do my sterile dressing change. grab by the non-sterile portion. And I would make minor adjustments, but making sure that I'm not touching the non-sterile part. Okay, now I am going to place my sterile drape just to have a good working environment. It's pretty sticky. So now I have my solution. Make it come down. So now I'm going to make this hand not sterile so that I can lift up the line after I start cleaning. First I'm just going to clean around it while I can. And then I'm going to make this non-sterile, making sure that I'm not tugging on the port. I'm just cleaning around for about 30 seconds, ensuring that I'm getting all of the area. And then now I'm going to use the Q-tip to get any, if there's any gunk or anything around here. That's good. I have my bio patch in here. And I'm just going to place over the top of this. And I would let that air dry. And now I'm going to drop that down. And again, while I'm doing this, just keep looking at the site and making sure that it is okay. Putting this over. Pressing it down, making sure that this is good. And a good seal. Are you doing okay, Chester? Good. Place this tape on here so that I can label my site, my initials, the date, and the time. Perfect. Clean up my workstation. And dispose of my gloves. I'll take that mask from you, okay? And then I would perform hand hygiene. And I would don a new pair of gloves. I'm hoping that this antibiotic should help you feel a little bit better, okay? And then I'm gonna do my second mid check. Okay, ceftriaxone 1 gram, IV push every 8 hours, ceftriaxone 1 gram, perfect. And my heparin IV, 500 units per 5 milliliters, 500 units per 5 milliliters, and I've already verified with my second nurse. I'm going to clean my port, 10 to 15 seconds. Let that dry. Do one last med check, or I'm gonna flush it. Before administering the medications. Get all the air out of here. Unlock this. Ensure that it is still patent by pulling back and watching blood flow, making sure not to get it into the port or into the hub. And then I'm going to use the push pause method And with this, if there is any resistance and it is not being flushed, I would not want to gather any or instill anything further. So now that I've done that, I'm going to do another med check before I do this. Ceftriaxone, 1 gram, perfect. It matches. Make sure there's no air bubbles. Unhook this. And I'm going to want to administer this over about 3 minutes, watching for any adverse reactions. And then I am also, but for video purposes, I'm just going to instill it. But it's important to do it for 3 minutes since it goes into the system very quickly. And he's not having any signs of allergic reaction. Perfect. Clamp this. Dispose of this in the sharps container, and then I'm going to give heparin IV flush 500 units per 5 milliliters. And then I am going to actually flush before flush so that I instill that or ensure that all of the medication is through before I administer the heparin. I can get the line out of, or the saline out of the package. So I'm just going to let this go so I can wipe it again so I can get this out of the package. There we go. Okay. So now I'm going to wipe again since it is not clean anymore. 10 to 15 seconds. Get all of the air bubbles out. Unclamp this, and I'm going to flush using the push pause method. Still feeling okay, Chester? Good. Close this. And then now I'm going to administer the heparin. Heparin, 500 units per 5 milliliters. Unclamp this. Using the push pause method, I'm going to administer this medication. Close that before I discontinue. Throw this in the sharps container. And then I am going to, again, stay with my client for a little bit and document everything. Make sure there's no allergic reaction. I'm going to document how the site looked, the patency of the line, how he tolerated the dressing change, the medications, what medications I gave, and the time and everything, and just make sure that everything's good, and perform hand hygiene.